Hello, everybody. Welcome to our live talk. Welcome to the anxiety series. Today, we are pondering on the theme social anxiety disorders. I welcome Neil from Western Australia, Kacy from Germany, Dietmar from Austria, Dennis from Kenya, and we are still waiting for our colleagues from India, Priya and Gautam, and for Veronika from Tobago. Hope they will drop in. Thank you, everybody, for being here. And may I ask you that you introduce yourselves a bit, and then we jump in the middle of the discussion. Who wants to start?
Hey, just let me start. My name is Dietmar Werner. I'm from Austria, and I'm now 58 years young, and I'm the owner of a small company which deals with actually pharmaceutical law. But the reason why I'm here is the Spagyric products, which are complementary medicine, and we are specialized in mental health treatment.
Nice. Nice. Yeah, very nice. Very nice. I'll go next. Neil here from West Australia. I work clinically with people who have all kinds of struggles with their mental conditions, and in a sense, pretty much everything physiologically that goes on with people has a psychological component as well. So there's almost nothing that I see that doesn't actually have a psychological element to it. And anxiety is a big piece. It's a big piece in the puzzle. So I'm very grateful to have you, Dietmar, on the call. You've introduced yourself first, and there are many options, many opportunities for us to actually work with things like anxiety, with these sorts of alternative routes that you've obviously got access to. So I'll be thrilled to hear everything that you've got to talk about, and of course what everybody else has got to say as well. That's me.
Okay, I'll go next. My name is Kacy. I'm an American who's been living in Germany for almost 40 years. My husband and I started two companies where we are ADHD Coach Center for adults who are struggling with ADHD. And we have an ADHD Academy where we train people who are interested in becoming ADHD coaches. At the moment, primarily with adults, but as soon as we find people who are very interested in working with adolescents or with children or students, then of course we'll incorporate that. But at the moment, our focus is on adults. And yes, anxiety, fear of the future, especially, and the combination with trauma they're crucial topics that we speak about. And it's something that affects many people, not only those with ADHD. I'm glad to be here. Thank you all for having come.
Thank you.
I'll go next. My name is Dennis Kevenji. I'm a medical researcher or a research consultant based in Kenya. I established a company called Medrate Consulting Limited, where I do public health research, and that includes mental health research, although I would say I haven't done quite much about mental health research, but some projects that I did previously have incorporated this aspect. I'm here because I feel that Africa is somehow left behind in mental health research and even practice, and therefore we need to be part and parcel of everything that encompasses it so that we can grow with the rest of the world. Yes.
Thank you, Dennis. Thank you.
Thank you.
Gautam, you arrived. Great.
Yeah, thank you. How are you, all of you?
Good.
It's a wonderful way to start the day. Also, say please 2 words about yourself for those people who don't know our group.
I? Okay,
yeah.
So bad. I think everybody knows me on the group, but by the way, I'm a homeopath from Mumbai, India, and I have been a regular participant of Future Link, thanks to Marianne. And I really appreciate the work that you all do, because normally we have not been exposed to so much of like if we talk about Neil and if we talk about Kacy and for Veronika and if we talk about everything, like whatever you have been doing, uh, Kshitij, that the social work and during COVID times also we saw without internet how you have been providing help and aid to people around you in Africa. So I admire you all. And for me, I have been working with patients in India, mainly with psychosomatic disorders and whatever I can do with my counseling sessions and homeopathy. I think that's all that I can tell about myself.
Thank you.
Thank you.
So let's speak about social anxiety disorders. As far as I am concerned, social anxiety is a main thing. Me thinking about what people think of me. And when I think of Marshall Rosenberg, he always said that's the first step towards violence is self-judging, being judged by others and thinking about what others may think of you. What are you saying on that topic? How can you get along with it?
Can I start?
Yeah, just start.
Yeah. Uh, Hi, Priya. I first didn't see you. Hi.
Hello,
Sorry.
Priya.
Hello, good afternoon,
Then, yeah.
everyone. Sorry, I'm late.
When we talk about social anxiety disorders, this is the commonest kind of disorders that we have actually witnessed with ourselves and also our patients. Many a times we don't understand it as a disease or we don't understand it as a deviation from the normal health. We feel that anxiety should be there, but I accept that anxiety should be there. But when it goes into the pathological existence of the symptom, when it interferes with our normal sociological and professional relationships, then that is what is called as a disease. So when we look into the factors or when we look into, I go a step behind, and when we look into what causes it, so any symptom on the mind, on the plane of mind, is caused by intrinsic and extrinsic factor. So internal factors as to our development, our perception towards life, our growth, our state of mind, and our mental understanding of things around us. And extrinsic, when I call, is uh, our environment, where we have grown, where we were born, people surrounding us, our friends, our family, and our professional group where we work or whom we deal with. But when we talk about this, it is our own wiring that matters. Whatever be the condition, where we are, and how we perceive this stimulus, whether internal or external, it will depend on our own wiring of our own uh, system, or when we talk in the times of the digital media, our own chip, microchip processor that we have inside us. The how we have formatted and how we have understood ourselves is what leads to this anxiety being healthy or unhealthy. A sports person also needs anxiety. Otherwise, a student also needs anxiety. A doctor also needs anxiety. Or if anxiety is not there, complacency will set in. We will tend to become overconfident about everything around us, and we will not be able to perform in a better way. So where we are, we see many a times people like in India, basically I'm talking about our environment, they have this 9 to 4 jobs. So morning 9 o'clock they log in, 4 o'clock they are out, and the whole life goes away in that, and they don't grow. They are happy with what they have. So is it really a state of happiness? Is it complacency? Or is it fear to fail? Or is it inability to perform? Now, when these guys meet across people who are having two shifts, who are having two, three jobs to look into, who invest in stock markets along with their jobs, and then they brush to them, and then these people develop a sense of insecurity, failure, a feeling of failure, a feeling of not doing able to perform, and these things on the subconscious mind goes into their performance about anxiety. This is what causes. Now, first of all, he or she has to understand if they are really happy from 9 to 4, they don't have to worry about the comparison. But when you go down inbuilt, we go down deeper, we understand that it is not happiness, it is laziness. So the person who is himself lazy or a person who himself doesn't want to perform is bound to suffer. You cannot. That is what you have to confront them with. Now, in anxiety patterns, I'm just starting with the introduction, then everybody can have an input. But when we come down to these things, the best thing that has helped us is cognitive behavior therapy. So when we talk about this, we tend to go into group sessions also, and tend to go into personal sessions also. Group sessions where family is involved, wherein we have seen that second generation or third generation people working in the same family business, they have that pressure already on them because their great grandfather or the father is always there to tell them or point to them that it is I who have built it and you are just degrading it. So that performance pressure is there since childhood. Or a very successful medical doctor practitioner having his child constantly around, and the child while growing up is seeing so many flamboyant medical professionals in the house, in the parties, and the child himself starts with that pressure that I also have to reach up to that watermark. So these are the extrinsic factors. So these kind of anxieties require a group session with the family with regards to the child. The parents have to understand that um, um, a monkey cannot fly and a vulture will be unable to swim faster than a whale. So you'll have to understand that every person is wired or framework of personality is different, and that has to be understood with regards to curbing the anxiety on the family level.
Yes. Gautam, let's talk the others a bit.
Yes, yes, yes.
Anybody who wants to answer to Gautam?
Just have a question to Gautam. Does he distinguish
Thank
between?
you.
Oh, sorry, I didn't see you.
Go.
No, Dietmar, go on. Go on,
Okay,
Dietmar.
thank you. Do you distinguish between fear and anxiety? Because you mentioned
Yes.
sport. I mean,
Yes.
fear is something which is very important in our evolution, fight and flight reaction, you know it. And if you fear when you go to competition as a sportsman, it just prepares your body for the competition, for the fight. But when it comes to anxiety, you are blocked. Yeah, so you can't move anymore, and these are the which is called in sport you are a training champion. Yeah, so you go to the training session, you bring your performance, and if it comes to competition, you're just blocked because of the fears, because of all those stuff which comes into you during the competition, like the people around, the noises, smell actually, and so on. So that's why I want to ask you: do you distinguish fear, like the start, and goes back to?
Dietmar, people with homeopathic background will know what this answer is. It is a very simple answer, and you have missed maybe our previous sessions. We in the first session we have defined fear is what and anxiety is what. Anxiety is fear of the unknown.
Mm-hmm.
Can you say
Fear of the
more? I didn't
unknown is
understand.
anxiety.
Mm-hmm.
And what is fear? Anxiety of the known.
Anxiety of the unknown. Is that correct?
Anxiety of the known.
Of the known.
Anxiety of the known.
Okay.
Anxiety of the known is fear. See, you may have a child may have a fear of dog. But what would be the anxiety? Whether the dog will bite me or not.
Mm-hmm.
The student may have a fear of the examination. But what would be the anxiety? Whether I'll be able to answer or not. A mountain climber will have a fear of heights. But what would be the anxiety? Whether I'll be able to conquer those heights or not. A sports person would be having a fear of the tournament. But what would be the anxiety? Whether he will be able to surpass his competitors or not. So
Let me
anxiety.
point it out in German for the German speakers. Furcht ist etwas Konkretes, Furcht vor etwas, was man fassen kann, während Angst etwas ist, was auf etwas Unkonkretes geht, etwas Unbekanntes. Just translated it in German.
I'm learning it now. So I'll be next two sessions I'll be able to talk in German.
Wow. Wow, Gautam. Amazing. Amazing what you're all learning. Let me answer from the perspective of a consciousness trainer. As a consciousness trainer, I would say anxiety in itself, whatever, and fear is a disease. Only danger is real.
Wait a minute. Anxiety is a fear of...
Anxiety, fear, all is delusional, whereas only danger, concrete danger, is real. This is how we consciousness trainers put it.
And the third part is fright. Third thing we are missing is fright. Fright is based on the past experiences, and the concept that we develop is fright. That is how we differentiate in homeopathy rubrics.
Yeah, this is true. For consciousness trainers, only the here and now is real. When you go for past things, you're back into delusional things. And you take the past and project it in the future, and then you're lost.
Okay, but this we're beginning to touch on to concepts of trauma, which of course affect anxiety and fear and how we behave. Because you're right, we take issues from the past and project. And we have, of course, different parts of our brain that are there to help us survive. So when we get triggers, we automatically go into something that has kept us alive to the point that we're at now. But those are often negative behaviors. So now we're opening up this whole concept of anxiety to working with traumas also as they come up in our imagination, in our brains. So it's a huge topic. I'm delighted we're talking about it. And Gautam, you also brought up the concept of, which I found very interesting, laziness. I think I've seen the concept of laziness as being something that's very socially damning, but I think it is based on fear.
Maybe to add on that, perhaps I would say that I've observed from some of the research study reviews that I've done that there are also genetic factors in social anxiety disorder, whereby, for example, if a parent had social anxiety disorder, their child may get it through inheritance of specific genes, though these are not clearly defined. So there's also an aspect of upbringing whereby a parent controls the growth and well-being of a child to an extent that they bring these anxieties into their life. So there are several factors, both environmental and biological, that should be considered in this aspect. Thank you.
Thank you.
Well, but Dennis, you bring in something very important, that there's a trend now that I'm seeing, I can't say for the rest of you, that there is an opening to more of a neurophysiological aspect here, that although a lot of our anxieties and fears are societal and have to do with being told as children, you're a lazy child, for example, you said with laziness, but now they are truly finding out that there are brains that have more of a tendency to go into fear or to go into anxiety or to go into aggression, etc. And these are physiological aspects that need to be brought into the discussion also. It's not all psychological. And this, I'm just seeing the first articles in German about psychiatrists, neurologists who are talking about the physiological aspects of all of this. So I think we just need to put that out on the table. Dennis, thank you very much for having brought that aspect up.
Thank you.
Neil,
I would also say that.
Neil wanted to say something.
No, I'd like to hear Dennis. Sorry, I'd like to hear Dennis.
All right. I would say that there's also a review that I did whereby I'm a medical microbiologist by training. So there's a review I also did about the gut microbiota, whereby I saw that distortions in their composition may as well increase the risk of some of these mental health disorders, including anxiety. So there is a strong medical link, or rather physiological link, that we should explore, even as we explore the social and environmental aspects that drive social anxiety disorder. Thank you.
Thank you, Dennis.
Priya, you're nodding your head. What do you have here? What are you thinking?
I was thinking about couple of things. What Gautam was saying about laziness being a kind of epidemic. So I was thinking of the various remedies I would think of if the basic nature of the individual is always indolent. Indolent is the rubric that we use. So if I heard from the parents that, this child has to be pushed a lot and has issues with transition or has issues with beginning things, so then there is starting issues with perfection, or starting issues without perfection, or persevere doesn't, or takes up various things and doesn't persevere. So I was thinking of those various rubrics and some of the remedies that come up. And because whether it be physiological, whether it be something that has happened now, whether there is a neurotransmitter, whatever, as homeopaths, we need to look at the larger picture. So we need to understand that, is this anxiety episodic and otherwise they are quite indolent? Then I would look at a calcarea group of remedies. So, fat, fair, flabby, indolent child, the calcarea self maybe, a baraita self maybe, doesn't begin things at all, would indicate an early toddler stage where they need a lot of reassurance to even begin things, that you can do it, don't worry, go forth, put one step forward. And then are they overwhelmed with the things that follow? Then we spoke about, if it is episodic, where like there's an exam that's come up and then you have to perform, and then is that anxiety just for that exam, and the rest of the time the child is okay but a little shy, a little introvert? Then I was thinking of various remedies. Then I was thinking about, what Dennis was talking about, the gut biome, because we use a lot of bowel nosodes as well. I was trying to remember whether there are any bowel nosodes which can be given as adjuvants, where, the current trend is to eat a lot of junk food and then put on weight, and then the addiction to video games and the addiction to social media, and then having indolence, but then having also this kind of anxiety about beginning new things or about going out. We have a lot of couch potato fighters and actual fighters. There are people who are very happy to sit on their couch and play video games endlessly. And then they're playing video games that are to do with a lot of violence, like they play Counter Strike or Tota. So there is something within them that desires that violence and loves that violence, but they're indolent. So they can't really go and actually be violent and indulge in martial arts. So that would be a different group of remedies. So these couch potato fighters, then we will think of probably, calcareas, or maybe even Helix aspersa, one of the mollusk remedies that loves this kind of couch potato fighting kind of thing. That the boy is very fat and indolent. He can get into a lot of fights when necessary, when he's pushed to it. Otherwise, he needs to be pushed tremendously to even begin things. And he has issues with transitions, or he has issues with thresholds. Like to go from one situation to another is very tough. And then, along with the anxiety of the situation, the distinction that Gautam made was very interesting, where fear and anxiety. Anxiety is a very generalized thing that you feel throughout your body, and fear is of a very specific thing. So you can be anxious about what the outcome of an exam might be, but the fear is very specific that I will fail, I will not be able to begin, I will not remember. Then we are thinking of the calcarea silicatas and the silica, if they're very lean and thin, and the calcarea silicatas, if they're, more fat and more perspiration on the head and all that. I'm sorry a little about the background noise. If there's anything that's disturbing, is there anything that's coming up? All right.
No,
Zoom.
no.
Zoom is great.
Uh,
That
I'm
means.
sorry. I'll
I
just,
just want,
Priya. Okay.
I'll just finish that and then hand over to you. So then, this is what were the things that I was thinking of, because I look at anxiety, but I know that anxiety is just a label that we've made to understand that big process and all those phenomena that come that are put under either generalized anxiety disorder or social anxiety. And if they're very specific social anxieties, then I would think of silica, calcarea silicata, maybe even thuja. Thuja is a very strong component, lycopodium, very strong component of social anxiety. So those particular events where you're in contact with society as a whole. So we're row four remedies which have to do with being in society. But then there are a lot of those lithium line remedies as well, which are, more generalized anxiety disorder and specific anxieties, even about the environment, things around them that affect them. I have a patient who says, is there something that they're putting in the food these days? It's affecting me. When they do the COVID test, are they putting some transmitter into my nose? Can they track my movements? That kind of anxiety, which is, more a lithium line kind of anxiety. So those are the kind of remedies and things that I'm thinking of and putting aside as each of you are speaking. So somewhere apparently even I was shaking my head that apparently even bowel nosodes are indicated, and I would have to, kind of keep it in my decision tree. That's all I wanted to say. Thank you. Yeah, go ahead, go.
Thank you.
For the homeopathic therapeutics, like for the rest of the group who will not be aware about therapeutics, what Dr. Priya was speaking, I'll be adding up the notes on the Telegram channel for our speakers. But for Priya, I'll just take this opportunity. See, you when Dominic mentioned about gut bacteria and when you nodded your head, so you would have looked into the miasm of tuberculum miasm, so tuberculum drug. And Lyco would cover up laziness and anxiety and the gut bacteria also. So when you talked about calcarea group, for the rest of my colleagues present here, we have certain groups which move together, certain drugs which that move together. So they are like for calcarea, it is calcarea, lycopodium, sulfur. We call them as cognate remedies. So these are certain remedies, they follow each other well. So the laziness of calcarea goes into the mental indolence of lycopodium, and in the sulfur we call them as a sterile philosopher who may just talk but not act. So these are the group of remedies in homeopathy which go follow well with each other. And when you talked about the violence which is now expressed in the form of games, so if you have patients, you look into basic drugs of Kali carb. Kali Potash, Kali group has dreams of battles. So they have these tendencies which they imagine themselves to be in battles. And also a drug called Staphysagria. So that Staphysagria patient has, when he has a fear, his legs tremble and he has so much of lot of pent up emotions. So now we go back to the gut bacteria and we leave the therapeutics. So whenever there is a person who has this, who is basically a coward, a person who is basically doesn't have the physical strength to fight, and then mentally they have a lot of anguish, a lot of mortification. And these are the patients where we see, Dominic, if you go back to your patients with gut bacteria, you will see them to have a lot of problems in expression of their emotions.
Mm.
So people who have a lot of suppression of emotions tend to go into a derangement in the gut bacteria, and they tend to have a lot of anxiety. So it is a vicious cycle
But isn't that
which goes
again
from
the
one
thing
to the
about
other.
biological? You're
And
connecting
somewhere we have to stop. Somewhere we have to put a block. So maybe medicines, maybe psychotherapy, maybe group counseling, maybe a healthy lifestyle with a healthy food going into the gut and also exercises. So all these factors help in nowadays people in India or maybe abroad also you've seen, they say that go for yoga or meditation. Why do we say that? Basically, it is channelizing of your thought process. Our thoughts, they are running on horses all over. There is a lot of dissipation of energy. Neil, you'll be able to tell us about the dissipation, laziness on the cellular level and dissipate wastage of energy wherein we plan a lot, but we don't execute much. What Priya was telling, leaving it halfway, losing interest halfway. So we try to start with a lot of zeal, but when it is the process is going on due to the changeability or due to anxiety again in inverted commas, we tend to go towards something else. So we leave things halfway. I'm sorry, I'll not disturb you all again. Please continue.
It's okay.
Maybe I am going through an anxiety right now.
I'd like just to jump in if I could. And there's a couple of things. One of them is that we're talking about anxiety and we're thinking about it out into the future, so like it's stuff that might come to us in the future. And what I'm aware of is that people can quite happily actually be anxious about stuff in the past. So you're sitting there in so-called in the present, but you're actually worrying. You're worrying about something which has gone on, beforehand, and that's another extraordinarily important issue. And what Dennis was talking about, Kacy, you were talking about as well, with this business of the physiological pathway. So the actual patterns in the brain around this. It's actually out in the body as well. So like the nervous system in the body develops habits and patterns, which are incredibly important. And Dennis, what you're talking about with the microbiome, particularly the gut microbiome, there's this amazing interaction between the habits about what we're doing. So in my approach, the way I'd be looking at this is I'd be actually talking to the microbes, because that's the sort of thing I do. And I'd be working with them to try and actually get a new pattern, a new habit. So in other words, the way that the microbes would be communicating and collaborating and cooperating with each other and with the cells of the body, particularly with the intention of these sorts of new neural pathways that, Kacy was sort of touching upon there before. So in other words, if we focus and concentrate actually on the communication between the gut flora and the needs of some new pathways, actually, what we would think of as neural pathways. If we have that focus, then there's a tremendous number of differences that can actually come out of that. And as I say, as idiotic as it sounds that you could be worried, like having anxiety or a worry process about something that happened in the past, it's it nonetheless, that's how powerful these patterns are, and that's what Kacy's talking about. It's a physiological pattern. It's what you're talking about, Dennis, as well. It's actually a pathway, between the gut and the brain. So the gut-brain axis, as they call it. So now that's just what I wanted to drop in, is that the picture's much bigger than we think. Like it's a really big picture, and it's not all necessarily 1 + 1 = 2. Anyway, I'll do a Gautam and I won't speak. I'll do less chattering. Yeah.
Yeah.
Dietmar, you see, it comes back to the same point again, that it is important for you to make spagyric remedies out of gut bacteria.
Oh, wait, I don't understand that. What do you mean make them out of gut bacteria?
Dietmar is an alchemist,
last time about
and he does spagyric essences.
I'm aware. Yeah.
And usually they do it out of plants.
Yeah.
But last time we already began to wonder whether it isn't a very good thing, or wouldn't be a very good thing, to do spagyric bowel disease nosodes
Are you
as remedies.
Yeah.
The basis of as we all know, there are fecal transplants that are used in healing for particular diseases, Parkinson's, things like that. Is this what you're talking about taking healthy bacteria from the gut and including them in? Am I understanding you correctly?
A bit more complicated, you know.
I'll explain.
Spagyric remedies are something between normal remedies and homeopathy, but we are already talking about the spirit of a remedy.
Yeah, so yeah, exactly. Neil was talking about that also. It interested me a lot. Dietmar, would you say a bit to that?
Yeah, certainly. Actually, the Spagyric products are working at three different from three different sites. They're working also aromatherapeutic, phytotherapeutic, and homeopathic. And these are actually plant extracts, and they are actually, as you know it from the phytotherapy. Yeah, if you have a physical illness, you use the phytotherapeutic product, and also the Spagyric products work physically and also mentally. And this is the combination where we could combine products or plant extracts working on the ball bacteria for. So you don't take actually or do extracts from the ball bacteria. You take the plants to get the healthy ball bacteria. There's a difference.
Maybe to add to that, I would say that as a PhD student in pharmacognosy and alternative medicine, I've also explored into that a bit, into how we can leverage medicinal plants to restore the homeostasis in the gut, whereby we, as we change lives due to industrialization and processing of foods, gut bacteria becomes disoriented in favor of occurrence of such diseases as anxiety. But then we can restore the normal population and composition of gut microbiota by using specific plant extracts. So, for example, Africans are known to have been using certain medicines or certain medicinal plants to target some mental health issues. So yes, they recognize that this is a mental health issue, but then they administered herbs to target them. So that means there is definitely that link between the brain and the gut, because the extracts or the plant materials go into the gut and they influence how the mind works to remedy these conditions. So there's that room to apply pharmacognosy, or rather the use of herbal medicines to influence the growth of good bacteria and the balance that is required to maintain mental health. Thank you.
Thank you. Neil, you brought up an issue that I wasn't quite sure of. It has to do with all of this, of your communicating with the gut bacteria.
Neil, your mic is muted.
Sorry. In my work, Kacy, I communicate with just about anything you can think of, including gut flora or microbes in general. And what you find is very, very allied to what Dennis is talking about, which is that you can encourage. It's almost like herding the cows, trying to get them into another field. And you can do the same thing with the gut bacteria, is that you can encourage through intention for the gut flora to actually become balanced in a different way. And it's a facet of homeostasis, but what you're doing is you're actually shifting the balance point. And so with your the vegetable remedies and that type of thing that you're talking about, Dennis, and also Dietmar, effectively what you're doing is you're coming in with a suggestion. This is my opinion. Okay, this is how I would approach it. Is that there's an intention being set by the actual remedy, and of course, what I do is I just go in directly with an intention at a consciousness level. So we make that intention. So we have tremendously good success with working with all kind of so-called pathogens. Things like Candida is the obvious one. That everybody talks about, and by getting into an intention process where you are working with the Candida around becoming cooperative and collaborative, then you can get great outcomes. And in fact, you actually get the Candida helping out. It'll help out with other bacteria, whether they are so-called good or bad. And they also help out with the the cells of the colon, which might be struggling, like they could be in some sort of pathology. So I'm talking about a psychological disorientation process with the gut wall, for example. So those would be expansions into it. And what I'm interested in, fascinated in hearing everybody here, of course, is just the way in which intention or the messaging actually occurs. And, homeopathy is famous for this, but many other different ways of approaching it as well. I'm really interested in what everybody else is doing. I hope that's answered you, Kacy.
Thank you very much. Yes, thank you. Priya, Gautam, how do you guys react to what Neil is doing in terms of the communication? And I do know that this is something that's real.
So as Neil was talking about Candida is one of the homeopathic remedies also. So I'm not very conversant with the themes of the remedy. They've all been proved as well. Candida, I know, has been proved. I know that one of the remedies that comes very close to it is a Calcarea lacticum or something to do with um, uh, children that don't thrive, or where they don't put on weight, or they have these temper tantrums. I think Tinus Smith has done a lot of work along with the link between the gut biome and autism, and whether there is anything that can be done with the leaky gut and which will affect autism outcomes and make the remedies work better. So as a homeopath, my first line of inquiry would be, can I understand this person who's in front of me? If it is a child, then can I understand through the mother's history in pregnancy if there is anything that any issues or any themes which come up? And if the themes are there through and through, then can I understand it from there? So sacrum lactis, officinarum and sacrum lactis are remedies for us. So we understand that the nutrition, and they belong to the nutrition line itself. So I understand that this kind of tantrum throwing, and which is accompanied, we would say, with disruption in the gut biome, would work very well with this. So, and Calcarea lacticum, lactic acid itself is a remedy. I would think of other milk remedies, perhaps, issues with nutrition. And I would try and understand which bowel nosode that I can give, perhaps. But I do know, I do remember now reading about in some other forum about this mother or parents or some book that they tried out this the entire it's available on Amazon. I think the entire gut bacteria can be dosed every day, or you get these capsules and you can have them, and then it helps recolonize. So this is something what Dennis was talking about, perhaps, that they can recolonize the gut of children who are on the autism spectrum, and it then helps control the leaky gut, ergo then helping with the the immunological part of it, because the immune receptors are formed in the small intestine. So, and if there are any eating disorders along with that, then these remedies will definitely help. So, saccharum officinarum, chocolate itself as a remedy, calcarea lacticum, lactic acid. These are the things that I would think of. Now, Neil's work is completely, I've sat on panels with him many times, and I think his work is perhaps something that where we would reach in a few years, maybe in 10, 20 years, but his work is far ahead of our time. We are simple homeopaths who deal with the symptoms which come in front of us, attempt to understand the individual as a whole, and try and see if there is anything in what we know that we can compare that has, clinically we have confirmed. Or if we don't know, then we try and repertorize those symptoms. And if there is a group of remedies that come up, then we try and understand from the remedy understanding which particular group this could fit and what would be a good fit for our patient, depending upon the age. The pathology has to get covered. So this would be a general way that we would work. I'm open to, I know there are quite a few homeopaths who work with bowel nosodes quite well and very successfully. I haven't had the bandwidth currently to till now to actually explore and understand. I know that I have a book somewhere in my library that I have to begin reading, but we do use. So it's important. Yeah. Thank you.
Are you also saying, obviously, when you're talking about people who are affected with autism, all of my antennas go up. Are you saying that through doing essentially an analysis of the bacteria in the digestive tract, and Dennis, this might be something you could also speak to, that we can actually affect the autism, the level of autism, and or of course ADHD, because we're talking about a spectrum of different psychological issues. And are you suggesting that when we have people who are, let's say, extreme in their case, whether it's ADHD or moving all the way over, that by doing an analysis of the gut bacteria, that we could actually affect the severity of what they're working with? Dennis, Priya, very interested in hearing this. It's a new thought for me that through a physical analysis that we could have an effect on the psychological effect. And no, of course, we're talking about anxiety and fear, but we're also talking about where that's coming from. Is that what you mean, that we should start doing analysis?
I would say that from the information I've seen, this is work in progress, whereby we are continuously understanding the relationship between the composition of the gut microbiota and the various pathologies, that is including the mental health disorders and even the other non-communicable diseases like diabetes, hypertension, and such. It's becoming apparent as people are doing metabolomics, they're understanding the link more. So as research goes on, we will get better understanding. But what is appearing is that if you maintain a healthy gut microbiome, that is a good balance of the good bacteria in the gut, you're likely to have a lesser risk of these various pathologies. So that's the general comment I would make about that.
Dietmar, how does this affect your work?
Actually, this is very interesting because we have a different approach. We're going through the immune system. We try to strengthen the immune system, and now there is a connection between, everybody knows the connection between the bowel and gastrointestinal bacteria and the immune system. And we're having this approach to strengthen the immune system, to strengthen the mental health. We have a client that has reduced, in connection with their physicist, the antidepressants that she took while taking spagyric as a phyto extracts, as a spagyric products. And that was very interesting because these products are meant to strengthen the immune system. So after a period of 3 months continuously taking these products, she could reduce the antidepressants. Yeah, she took the selective serotonin inhibitor, reuptake inhibitor, and actually, this is very interesting because I I could see, or I could take a look what's about their gastrointestinal tract, the function. Yeah, did this change? Yeah, was there any difference before and after? And so that actually could really be interesting to connect the gastrointestinal health with the immune system health and the mental health. So it's very interesting, and indeed it does infect my work, and it gives me a different approach.
Yeah, you know, we have the 10th nerve, the 10th brain nerve, the vagus nerve, that goes from the brain to the gut. And this is a great feedback nerve between the gut bacteria, and the brain. And we can't forget about that.
That's true. Right now, there are a lot of books out on the vagus nerve, and I've been wondering, is that popular psychology, popular neurology, popular biology, or is that really something? I don't know enough about it, but I do know it's supposed to be a central component. Can anyone say a little more about it, because it affects everything we're talking about here in terms of the physiology of the body and how it affects the psychology?
I can tell you, if you do resilience training and you balance the parasympathetic and the sympathetic system, you get a balance, real coherence in it. Your health, your immune system, and your gut bacteria improves.
Is this something that they also do before and after? Dietmar, I found it very interesting that you were saying that you would actually do an analysis beforehand and see how it's been changed. Because this is the kind of thing we need to do. We have so many different approaches to what we're talking about, which of course the basis is anxiety, but we've gone off into many different directions. But we have to find some sort of a synthesis of what we're working on. And you have to be able to say before and after somehow what has actually had an effect. The concept of a healthy brain needs a healthy body, which needs healthy gut bacteria, which needs all of these issues, because we are an integrated unit. We're not separate. There is no separate brain, separate body, separate gut.
No. The main feedback is the client. The client that says, I am better. I feel better. And then if you want, you can take samples and see, is the gut bacteria better? Is the resilience better? Testing the heart rate variability. If you want to scientifically prove it, you need to do tests. But the main feedback that says, I sleep better, I don't have to react anymore, I'm much more into myself, much more self-confident.
Still need a basis. Dennis, how easy is this stuff to do? I cannot imagine it. You are a specialist in this arena.
I would say it's not easy. Actually, it's quite cost intensive. Doing the
issue.
Yeah. Analyzing the composition of the gut microbiota is quite cost intensive. Like I would say in Kenya, we are not yet there. I think there is about one lab or so that does it for research purposes. So it's expensive, and therefore it will not be feasible to conduct it regularly. But I think with the time, because genetics and bioinformatics is becoming cheaper as technologies develop, we will get there soon. But then at the moment, we might not feasibly do many of such tests.
Thank you. So once again, Marianne, as you say, the most sure result is when the person that we're speaking with says, I'm doing better.
Yeah.
Also,
testing the heart rate. Just a moment.
Yeah.
Testing the heart rate variability is very cheap, But a gut bacteria test is very expensive. Even in veterinary science, where we tend to do it, you won't go below 300 euros. Priya?
I very coincidentally just this week I had a Facebook post from a colleague in London called Kushmark, and her post was about the fact that this is a big trend in Europe right now. People get their gut biome and tested, and you send in a sample of your poop, and they bring a report which says you have so many, so many, so many. But without the gut health markers themselves, I think this kind of biome understanding would is actually not complete, is what her opinion is. And I concur with her. I think without gut health markers, just understanding what is the composition of poop doesn't really, in my limited understanding, help. But for me, I'm more interested in the other end of the gut, about what actually medicine I can give, what can make them symptomatically better, what are the other parameters that I can look for, even with the ADHD, ADD, autism. They all, the linking thing with them is they all come with various levels of anxiety, right? Person who has ADD, ADHD, or autism or Asperger's, they have increasing or decreasing variations of anxiety and intensity of anxiety in them. So I would look at what are, so the person in front of me, how developed they are, what are the other symptoms they have. So I would focus on the main, my focus would be on the ADD or the ADHD part of it. And if the constitutional or the remedy is right, then there is overall improvement, which includes also gut health. So, and
Definitely.
if those symptoms are diluted and the intensity of those symptoms goes down, there is an exam and the person is doing better. The anxiety where it was previously 9 on 10 is now 5 on 10. But in the exams, it goes up to 6 on 10 or 7 on 10, which is a situational anxiety, and it is correct for that situation. And then otherwise it goes down. The issues that are there previously, wherein they have to be pushed to do things, they are very, very indolent. Parents are spending 4 hours sending the child to school. Teachers are spending so much time to give extra instruction. They have an extra teacher. They're yet not able to perform, many other issues with that ADD. And, then for me, that is more important than, the level of specific bacteria in the gut of that child. So then when I focus on that larger picture, zooming out, and I understand that these are the things, then, and when overall improvement happens, I trust that improvement has happened even at the gut level. So, because I know that the immunity has improved, because the child was falling ill at every change of season with very bad colds and coughs that last very long and deep chest coughs, is now just getting sneezes. The child was not able to eat things before, getting a lot of urticaria and new things cannot eat, and very, very set in their ways, and lot of allergies to various foods, along with these ADD issues. It's now able to eat things. They're spending less time trying to find what he can eat. And I know that that remedy has taken care of that. So I would work at the end where at the end where I can give remedies, or I would work at a zoomed out level where I understand that I need to look at the whole picture, not just like one quadrant of the gut loop where I'm looking at specific bacteria. I think um, there is a danger even in India right now wherein we have super, super specialists, and that they only look at, that particular loop of the intestine even. They are not looking at the larger picture. And I think there is a lot of work still to be done at the larger picture level where, you can get better results than even at that system level then.
And Kacy, just a moment. Hahnemann said that all disease begins in the mind. And if you only restitute gut bacteria and you don't change anything in the mindset or in the emotions, the gut bacteria will collapse again. But if you change things in the mindset and in the emotions, and you eat healthy, or you add humic acid, then the gut bacteria can improve easily. Dennis?
Oh, sorry.
Dennis.
Oh, yes. I wanted to comment about the interventions aspect. For example, the anxiety about social disorders that we are talking about. Um, uh, Cognitive behavioral therapy is the recommended psychotherapeutic approach. But then we can talk about its accessibility. For example, in Kenya, where I am, I think it would take about 500 kilometers to send someone to some place they could get focused psychotherapy for that reason. So is there a way that we can simplify this, since CBT is about changing one's thoughts to one's supporting their daily existence and routines rather than condemning themselves into these disorders? Is there a way we can simplify it so that it can be administered even at the home level? Then about the other therapies, for example, the pharmacotherapy, besides the SSITs, are there alternatives that we can localize, or rather we can have them accessible to even people in the villages who don't have access to the few healthcare facilities that are offering these mental health interventions?
Yeah, if you would have a homeopath around, it would be easy. But of course, I know that in Kenya we don't have many homeopaths.
Sure, I think
one thing you can easily do is meditation and breathing techniques. And by meditation and breathing techniques, learn to make your heart rate variability coherent. This is easy to be learned. You can learn it in 2 days, even all the theory behind it. And then if you go into this coherent state 5, 4, 6 times a day, it will help you get out of the fight, flight, freeze mechanisms and into a state where you can always consciously decide. And that will help to get out of the social anxiety disorders. Because you know your triggers sooner or later, you know when somebody looks at you with these eyes that you tend to get anxious because you think, did I do something wrong? But if you learn to get the heart rate variability coherent, people will look at you with these eyes and you just say, somebody looking at me with these eyes. No problem. So if you're interested in that, we can do a talk about that, but it's easy to learn. Very easy.
I would like to come back to what you said, Anne-Marie, from Hahnemann. Actually, that a fun fact, it goes back to Paracelsus, because he said already, heal your mind and your body will follow. That means even at that time, he knew the brain is one of the most important things to heal your health. But another way, you said before, what the patient requests is very important. There is a guideline in Germany, actually, from the Medical Society of Working Group. They gave a guideline in 2021. Actually, it goes back to 2014. And there are recommendations for mental health, to treat mental health, and also for social anxiety, what to use, what kind of medical you use, what kind of treatment you can take, from behavioral therapy to even yoga, sports, and things like that. But the thing is, the most important in the guideline is written is what does the patient want. Yeah. So it doesn't make any sense if you have that's actually the quintessence of the guideline. If you treat them with antidepressants or anxiolytica, if the patient doesn't like it, yeah. So what they actually mean is, at the end, it is always important: is the patient aware or ready to take this kind of treatment? Yeah. Does he respond to this treatment? Is this treatment something what he can live with? Yeah. And this is the point what you said before, and this is, in my opinion, very, very important, because we made the experience that even the client told you before that the patient do not always like the anxiolytica or antidepressants. They want to first try to treat themselves with either complementary medicine or with sports or with yoga or meditation, things like this. Yeah. And even if you have a pause in one antidepressant to another one, or to another medical treatment, you need a pause in between. So they take the chance, the pause, to take something different. Yeah. Or to do something different.
Dietmar,
resistance is a major theme.
Mm-hmm. Yeah. Yeah. And this is a more compliance from the patient to take part of this treatment.
And thank you for mentioning the anxiolytic and the antidepressiva, because now, as we talk, that we have in all anxiety disorders, in social anxiety especially, we have these gut issues. We see that the antidepressant and antidepressiva, they can't change the gut bacteria. So they eventually will fail.
Yeah, it's right. This is actually a side effect to get more to get diarrhea from some antidepressants. Yeah.
So actually makes it worse.
Yeah, that's right.
Wow.
Mm-hmm. That's a very nice conclusion we are making here. So if you want to treat social anxiety, you need to go to cognitive therapy, maybe consciousness training, maybe resilience training, and you definitely need to restitute your gut bacteria, either taking homeopathy or spagyric or bowel nosodes or very healthy food or plant extracts. But there the traditional knowledge kicks in, where we used to have the old women who knew, if you have that problem, even if it's psychologically, take that herb. But that knowledge is going to be lost, even in Africa, because people don't write it down. They only pass it on talking. And Dennis, you should take care that the old women write it down, or somebody interviews the old women, and that it gets written down.
Yeah, that's what I'm doing. I'm actually shifting from microbiology towards pharmacognosy, because the end point is helping people heal. So if you don't know what can help them heal, understanding the disease might not be useful. So I'm getting into studies that interview these healers or the herbalists to get to know how they used various plant extracts to treat diverse illnesses. And I take it and then proceed to the lab to test and see the composition of these plant materials, and where possible test them to see their efficacy against various illnesses. So the purpose of that is that some of these interventions that they use, the way they prepare them, if they are not standardized, we may not be able to increase their reach. For example, if sending it to someone in Germany, it might not be feasible in the crude form. So we must have a way of preparing it such that someone in India can benefit from something in Kenya. Chinese have advanced in this a lot. That's why traditional Chinese medicine is now or can now be considered a global intervention. So in Africa, I'm aiming, or rather, I'm dreaming of getting there where we standardize and register these products so that they can be accessible by everyone across the world.
It
That
sounds
would
like
be a very great idea.
that would be a good connection with you, Dietmar. You know, we're talking about
Yeah,
bringing in natural products that can truly help. So I hope
absolutely, absolutely. The problem what I see also is physicists usually don't know there is a mental disease behind. So they see you have gut problems, they see you have palpitation, they see you have heart problems or headache. So they treat uh, the symptoms, yeah, and they do not know maybe the mental problem behind all these symptoms you show. And this is actually what I experience is a problem because they don't ask more than, um, yeah, they don't go
They
to the
don't
mental
they don't get the big
sphere.
picture.
Yeah, they don't get the big picture. Thank you very much.
Yeah, and this is what homeopaths always do. They're always looking for the big picture. This is why the homeopathic remedies are so powerful.
So
somehow
But
we
obviously,
don't
it's
just
not very easy to learn homeopathy.
correct. So
It's a
we don't
lifetime study.
the plant, but the analysis includes all the whole plant and all the alkaloids and how they interact with the body. We understand pharmacologically individually, but then the whole plant is studied. And not just that, now we are understanding plants from which family or order they come from. And that understanding is also there with us, at which level of development we need to give. And in that, which, a plant can be related to another plant. So we do group family studies as well. So we know that if this looks like this, then okay, there are other remedies in that family. Maybe, if this, not this, then the brother or the sister remedy can help. So they all belong to that particular level of development, that group, that plant. We're doing that for animals as well. So a lot of animal remedies are also there. So, and then not just that. So pharmacognosy is about, so we study that as well. So not just that, but in homeopathy also we have provings where healthy human beings of both sexes, all ages, from various walks of life take those preparations and then write down the symptoms that are produced in them. So then you have an entire list of those symptoms which you can refer to if you have never prescribed that remedy also. So pharmacognosy, so the sources are many. So you get poisoning symptoms, symptoms from folklore, where it comes from. Somebody has seen something, some old woman has, as you said, given it for something. It has been given over the ages for something. And then, a sheep or animal falls ill after eating that particular thing, then understanding that it affects that particular system, post-mortem symptoms, and then all these provings. So the materia medica is very rich in its where the source comes from, source information. That is why these remedies still are being used for the conditions that they were used 200, 250 years ago when they were introduced into homeopathy. They're used for the same things and they're equally effective or efficacious even today. We just understand them in a much more organized way and in a deeper understanding of, in the current scenario, how we can use them.
I have a very basic question that in working with homeopathy or working with plant-based medications, Dietmar, also what you're doing, we are all human beings. But given the fact that there are many different areas in the world, whether we're talking about Africa, we're talking about Asia, we're talking about um, so the northern parts of the world, the Eskimos, or we're talking about the steppes, we are all human beings. But is it irregardless of where we come from, what our people have done for generations, or is it also affected by where we are? Would homeopathic remedies have the same effect on a human being from the depths of Nigeria, from the mountains in India, from Alaska, from Latin America?
Yes.
Does homeopathy work on the human basis that we all share, or is
Yes.
it affected out by cultural and geographic sort of generations of people? And
Yes.
obviously,
It's
too big
not
a question
affected.
to talk about here, but Marianne, maybe that would be a wonderful thing to talk about next time. I would
Just
be.
to give you an idea, Camilla Share has and Jeremy Share have an Africa project where they're helping. So they've taken remedies from where they live to help children who are HIV positive in in Africa. So the human condition is universal, and human DNA is the same. A lung is a lung is a lung. So it
It
doesn't really.
works on the essentially the genetic basis of all human bodies, irregardless of where they are, what the
It
culture.
works on the, if you're asking at which chakra level, which level it works on the subtle energy body, which all human beings have. So
That I can
it
understand.
is somewhere, I would be thinking of myself as if I said that I'm, of a particular social strata in India, and I would say that the remedy works only for me and it would not work for the low socioeconomic strata. So it would be that kind of mentality I would have if I would think that a remedy that would work for me would not work for somebody coming from a low socioeconomic uh, situation. So it's not like that, which is a logical fallacy. So it works on the subtle energy body that everybody has all over, whether you're a Eskimo, whether you come from Australia. So.
Thank you. Gautam?
Kacy, I think I understand your question well, that you mean to say that why is homeopathy not so proclaimed or so active in the other parts of the world? And why do we see homeopaths flourishing in certain parts of the world? I think that is what your question was.
No.
So if you go to see the background, wherever traditional medicines have been practiced in the parts of the world, these parts of the world are where homeopathy also flourishes and is also known to a common man staying in any rural area. Because we have, if you talk about Asia, if you talk about Africa, if you talk about any other such places where traditional, I would say, orthodox medicines were prevalent, whether you call it naturopathy, whether you call it Ayurveda, whether you call it plant-based medicines, wherein we have seen in tribal areas wherein they just open up a leaf and they crush it and they apply it to heal a wound. So wherever such practices have been prevalent throughout history, in such places or in such areas or countries, we have seen homeopathic medicines to be very active. Now, when the second part of your question, that a person staying in the Alps or a person staying in a desert area or a person staying in urban society, whether homeopathy works for all. So in that, the homeopathic medicine is based on individuality. A individual's system or individual symptom, it is not based on, now we have come down to the concepts of gut bacteria or anything else, or maybe a DNA molecule. But when our master laid down these principles, it was only based on whatever the cry of the diseases, whatever the deviation of the vital forces, whatever the patient tells as a symptom, whatever the relatives or the attendants observe as a deviation from a normal behavior. All these are sources of the symptoms that we collect. And like how Dr. Priya said, on the basis of that, we repertorize and we come down to what we call as the similimum. Now, for all of us speakers, we have Mary, actually, you have turned off the setting wherein I can put in some photographs. Mary, in your meeting settings, the other speakers cannot put in any media files. So what I have done is that on the Telegram channel, I have put in some representations of what is SAD, social anxiety disorder, what is CBT, and what we have to talk about for because our audience is many a time they are lay persons, they are not medical background. So what we discuss here or what we are discussing now is to understand our approach towards our patients based on all of our colleagues' experiences. But when we are talking about the our spectators of this talk, there are many a time they have to understand what is SAD. So, Mary, on the LinkedIn, on your LinkedIn post, I have posted all the photographs, and
Good.
on the Telegram channel, I have done it. So, you individually on your LinkedIn post, you can do it, where you can repost them. So, if you understand SAD and CBT, that is chronic behavioral disorder therapy. So, in CBT, we have a technique called ABC technique. ABC. A is the actual cause. B is the behavioral effect. And C is the consequence. So when you talk to your patients about what is CBT, you have to give them a chart. You have to prepare a chart on there, make 3 columns. On the first column, write down the actual cause. On the second column, talk about the behavioral. And the third column, you write down the consequence, emotional or physical. So the person has to understand what is the trigger mechanism, what changes they see in the behavioral mechanism or thought process, and what is the consequence. So, like when brother Dietmar talked about a sports person going through to a sports field, the cause would become the sporting event. What changes in the behavior the person will experience is flushes of sweat, uh, all symptoms of what we call as panic attack. When we talk about social anxiety disorder, the first thing the patient comes to us to understand a social economic disorder is the patient will themselves come and tell that I undergo a panic attack. So you will have palpitations, you will have heat flushes, the patient will have maybe trembling, the patient may have repeated desire to urinate or pass stools, and all this when they have undergone through the event. Later on, they may have that people were laughing on me. That consequence, emotional will be a negative feeling about themselves, or maybe a feeling that this was not such a big thing. Why did I fear? Why did I get that anxiety? So, when the patient have to themselves be a contributor to the treatment. Primarily, I'll tell you, medicines come secondary. First, we have to understand the patient and his expression and what is the cause. 80%, I have always been telling you, all of y'all, 80% of patients, they respond to plain placebo. Plain placebo is the response, is what helps, because whether it is a child or whether it is a adult, what they want is a person to listen to. In today's world, all our anxiety topics, when we talk, I mentioned this, that in today's world, we don't have time to sit and talk to our own family members. Leave the people outside. So what they undergo is that the feeling of acceptance and appreciation is not there, which is also seen in animals. These two feelings, if we understand it is the basic cause of all levels of anxiety: acceptance and appreciation. These are the causes. So when we say acceptance, lack of appreciation will go into anxiety. Triple A. So
This is
understanding
my
a person, married just 2 minutes. I'll not take much of a time. So understanding, when we understand a person, whether it's a child, the efforts of the child not being appreciated by the family members, and the parents may be not wrong, because the parents may again feel that if we appreciate the smaller things, the child will not achieve greater heights. But everything should be appreciated and the child should be motivated for further tasks. It is like when we go into game of level 1 and level 2 and level 3. So the child has to be understood or explained that this is level 1 is done with, now you go for level 2. So acceptance, appreciation will prevent anxiety.
Gautam, there's a huge effect though. Okay, there's a phrase in English that says we are all emotional cripples who were raised by emotional cripples, which means over time we have to learn in becoming an adult to not blame it's because my mother, my father, my whatever.
Yes,
And
yes.
particularly with ADHD, the children grow up usually not being accepted. Their behavior is often different than other people's. And
But
yet,
that is again,
challenge
but
as an
case,
adult
yeah.
is we have to accept ourselves. I'm sorry, it really comes down to that. It's reflected in others. But the only way to work with ourselves as we become an adult and as we learn to integrate all the different aspects of our lives is to learn to accept how we are and how we
Yes.
express ourselves and then be working on how we can work with others. But it's such a huge topic. Marianne, I'm glad we bring these up. I hope that people who are listening to this don't end up coming out with, oh my God, we're talking about all the difficulties and we're never talking about what to do about them. And we need at
Yes.
some point to be focusing on different things you can do, as you say, Marianne, with breathing, with meditation, with consciousness of your arena. These are things that will all help to bring us to a point where we can start working with the issues that actually are becoming very difficult in our lives. And I agree with you. It has to do with focusing here.
Yes.
But
Just let
explaining
me
this
just let
very
me say one thing. The main thing for a client with social anxiety is to learn and accept that he or she is not the victim of the emotions,
yes.
but the creator of the emotions.
You are
And
the
that you anytime can shift within 2 minutes from a negative emotion to a positive emotion. You only need to know how to do it.
no,
And
and you
it's
have
easy to learn techniques.
because you
But
can
when we talk about
you
a
don't
child,
it won't help.
when we talk about a child, these things don't work, ma'am. Mary and Casey, the breathing techniques, the meditation, these things don't work with a child. And if the anxiety of the child is helped by involving them in swimming or involving them in sports, whether it is ADHD, whether it is autism, you have sports for the mental for the challenged.
It
So
has
there is when we involve them in group activities and when we appreciate them. So what Barry and Cassie just said, we many a times we don't suffer. When you talk about emotional cripples, we become emotional cripples or we suffer due to the stupidity of people around us. So many a times awareness of mental awareness programs should be repeatedly be held at grassroots levels. Government will not help us. It is our duty to educate people around us, educate our community around us with regards to mental health. We cannot wait for government to have policies for mental health. It becomes our duty if we are looking into a long-term cure for our community, for our state, for our country, and for this world. We have to start with our efforts of mental awareness programs. Maybe it is one family first, and then maybe it is the society where we stay or the community where we stay. So that is when we say for a challenged child of ADHD, the Casey one when we spoke to Dr. Priya about the treatment part, we are not looking here for cures. Understand one important thing. We are not looking here for cure by homeopathy of a autistic child or cure of ADHD by yoga or therapy or any other therapy. We are looking here, what we have to understand is if some things cannot be cured, how can we improve the quality of life by accepting what we have? So, acceptance of the child of ADHD or autism, acceptance of child with any other mental syndromes that we talk about or any other spectrum disease that we talk about, that acceptance in the social level. Why are we talking about only mental health? A patient with vitiligo, leukoderma is still not accepted in our societies. Still they are looked upon as untouchables. People still have their mental stigma about a person with vitiligo. So it is the ignorance of a common man which causes a anxiety in a person who is either having weakness of mind or physical or having any disease or symptom which they feel cannot be treated. So it is many a time it is not the incapacity of an individual, but again, like what I started with, the external factors of performance pressure. Basic thing when we talk about anxiety, social anxiety disorders, is I'll uh, place it properly is performance pressure seen in a marital relationship, physical performance pressure. So many a patients come with symptoms of impotency or erectile dysfunction because they have a fear of not being able to satisfy their partners. So these things keep on accumulating over the period of time. And by like this is many a time we see it in post-menopausal or post-andropausal in a man. So every age group has its own anxiety levels, and every age group has to be understood and accepted and appreciated in their own brackets. So all these things will bring awareness in our society. Treatment is later, ma'am. Treatments, brothers, are late, comes later. First, we talk about the cause. We talk about the effect of the cause on the person involved and what consequence that it leads to. So therefore, understand and remember A, B, C. That's all. Treatment can be different. Treatment may not be required if you sit and understand the patient. We sit and explain to those people around them and help in curbing the anxiety. We don't want to cure anxiety. Like what Dietmar brother said, the anxiety of the sports person should be there. So this is what we call about positive and negative stress. Positive stress should be there. Otherwise, we will not perform. Now, if on Indian Standard Time we have to meet at 2:30, so I will have an anxiety that I reach my clinic and log in from my clinic by before 2:30 or 2:15 rather. So that kind of stress should remain. Otherwise, we'll start taking people for granted. And then that person will suffer because that person is taken for granted. So we have to understand between the positive and negative, healthy and unhealthy. When it starts interfering with our daily sociological and professional relationships and our occupations or our behavior, that is when it becomes negative. I had a patient who stayed around a kilometer from the railway station. Uh, Dietmar and Mary, correct me if I'm wrong.
Hmm?
Behnoff,
I didn't understand.
Behnof, Behnoff.
B-E-H.
NOF. What's the railway station? Anyway, so a kilometer away from the railway station, and he to go to his place of work, he used to catch a train. So he used to leave from his house, but before he reached the railway station, he used to start developing palpitations, anxiety-related sweating, a typical panic attack. So this is what is a social anxiety, one expression of social anxiety disorder. And he should not go to the station, he should come back home and sleep. On case taking on looking into the person's history and the background, we came to know that he had created some misappropriation of funds in this office accounts. So he had a fear of going to the office. So we cannot treat this as only social anxiety disorder. We have to go to the cause. We cannot think about medicines over here.
Okay. Okay.
Yeah.
So we have to understand the cause and why this is person is going through that disorder. We just cannot start with gut bacteria or Reiki or meditation or this.
No,
So
it's going to a feedback loop. But what you're telling here is that guilt in social anxiety kicks in, and this is true. Actually, there's another kind of therapy here that demonstrated himself.
pardon?
Cat therapy is
Animal.
one of the best
Yes.
therapies for social anxiety.
But here, see, the hygiene, you are maintaining it, you are taking care of your cat as a child. But here, when we talk about respiratory diseases or skin diseases in children, pets have become one of the causes of these diseases.
They can be, but once again, it's individual, and there are pets that do not do that. Some
Exactly my point. But what is happening here in exactly in Mumbai or India, when these kids are taken to allopathic doctors, they tell them completely, like that is a general umbrella. No bread products, no bakery products, no pets or animals, no preservatives, no cakes, no pastries, no candies, no chocolates. So general umbrella blanket ban is being put on these children.
they can't live with it. Yeah,
So that is impractical and illogical.
I agree. We need to continue talking. I unfortunately have to go now, but
Now we have to close anyway. We are past our time.
continue, Marianne.
I want to thank you very much. This anxiety series goes on. We are meeting in 1 month again.
Yes.
And there's still a lot of things to be talked about. But today we did reach a point where we see that there is a great feedback between the body and the mind, and that we need to understand the root cause in anxiety, and that we need to talk with the patient. And if the patient cannot be talked with because it's a child or somebody who is in Alzheimer's or whatever, we need to have to reach them by the heart.
Thank you.
Okay. Thank you very much. Priya and Neil had to drop out a bit before because they had emergency clients.
Dennis, all the best in changing your field. I think it's very interesting that you're doing that. And Dietmar, I do hope that we'll hear a bit more from you and other times about the work that you're doing in combination with all of this, because it's so important that we begin to connect with each other on what we're doing, because we're all no matter what. Thank you, Maria, for providing this.
Okay, thank you very much, everybody, and see you next time.
Thank you.
Thank you.
Thank you.
Goodbye.
Bye-bye.